I said, you're above Dr. Fauci on the list.
I'm Ayaz Samadani. Thank you very much for joining in. And this is June 16th, Cambria program number 33. Can't believe it, it's an update number 33. And the current situation with COVID-19 is changing very rapidly. And this information is good for today. And here are the numbers. You can see from last week, the numbers have jumped to 2.5 million cases with 100,000, nearly 100,000 deaths or just under globally, and which is slower than it used to be. So here you can see the new reported cases, and they are 7-day average, and they were peaked in January and then May, and now they have been down and down. So the trend is very good. Then we have new reported cases in the US. I think only 1,300 cases were reported in the last week, so which is not bad. Here is hospitalization. That has also gone down, and the numbers for United States, we have about 100,000 cases, new ones, and 2,000 maybe the deaths in 1 week. So which is also great improvement, and you can contribute that towards immunization and better controls. Here we have Wisconsin. Cases last week were 675, now 676, so 1,000, and the deaths are 7,981, and this week 8,023. And Columbia County had increased from the last week 7 cases and 1 death. And if you look at the vaccination rate, we inched up a little bit from last week. It was 52%, now 53.2%. And fully vaccinated, 2 doses, 44.12%. So 2 doses of Pfizer, BioNTech, and vaccine proved 79% effective against the Delta COVID-19 coronavirus variant, while the Oxford AstraZeneca vaccine, 60% effective. This was published this Monday in the Lancet Medical Journal in England. And you can see that these vaccines do work, and Delta is the one threatening us now. It was called the Indian variant as well. And here are, common answer to the question that these viruses constantly change through mutation, the changes, and new variants of a virus are expected to occur. Sometimes new variants emerge and disappear. Other times, new variants persist. So multiple variants of virus that causes COVID-19 have been documented in the United States and globally during this pandemic. So there are several of them, and I'll elaborate a little bit more on that. Variants of interest or variants of concern. So the B.1.1.7, first detected in the United States in December 2020. It was from UK, 1351, and first detected in the States end of January 21, and it was South African. And P1 was detected here in January 2021, and it was Brazilian virus. and B1427, 1429. These two variants were first identified in California in February. So numbers have been low on these viruses. And here is how to protect yourself. Again, this is a repetition. Get the vaccine and wear a mask that covers the nose and the mouth, and stay 6 feet apart from others. Avoid the crowds and poorly ventilated indoor spaces, and wash hands with soap or sanitize. So these are the same CDC recommendation have come in from day one. And here is a variant of concern, which is Indian B1617.2. Now it is by World Health Organization named as Delta variant. And it was first detected in UK. There were 60 or 90 cases. And now we have it in United States, and there are about 29,000 cases on that. And chances of getting infection after vaccination, which is Pfizer or Moderna, and is 2 in 10 with Pfizer and Moderna. So the people who have been vaccinated, 2 out of 10 or 20% may get this infection. And Janssen one, 40%, 4 out of 10. So the protection in Janssen or Johnson and Johnson vaccine is lower than Pfizer and Moderna. But on the other hand, if you don't know the territory you're going in, you're better with mask. So this is, that shows vulnerability. And here is Columbia County. Because of moderate COVID-19 transmission in Columbia County, unvaccinated people are at moderate risk, and vaccinated people are at minimal risk. So there were 4 new cases in the last 2 weeks and 2 deaths in the last 2 weeks in Columbia County. And these are, you're familiar with this slide we've been showing every 2 weeks or so. They didn't update, but last update here says May 22, but actually it was updated at the end of May or beginning of June. And again, on the 4th line here, B1617 Delta was showing 2.7. I think it's about 4%. So, and vaccines are highly effective against Delta, and after 2 doses. And this report was analysis of data from 1,054 people with confirmed Delta infection, and Pfizer was 88% effective after this 2 weeks after the second dose of the vaccine, and 93% effectiveness against B117, which is alpha. So AstraZeneca was 60% effective from Delta 2 weeks after the dose, and 66% effective against alpha. Both vaccines were 33% effective against symptomatic disease from Delta 3 weeks after the first dose, or complained with 50% effectiveness against alpha. So they are working, they will protect you, but as I gave you the percentage and number and chances, 2 out of 10 or 4 out of 10, it is better if you're in doubt, take precautions. Here is again, Delta in Scotland was found mainly in younger, more affluent group, and risk of COVID-19 hospital admission was approximately double, and those with Delta infection compared with Alpha. So this is a big threat in England. That's why they are taking all these measures. And risk of admission particularly increased with increasing number of comorbidities. Okay. Variants of concern or under investigation in UK are Alpha, Beta, and Delta. All those three we mentioned. And Delta, they have 29,892 as of June 2nd, new cases. And this is the nomenclature for variants. Alpha is B117 and Delta is B1617. So if somebody says I got Delta infection, you know that's the Indian variant. Oh, chilblains. I thought we presented one slide several months ago where they called it COVID toes, that people were developing dark color discoloration of the toes. And so there was a study now that chilblains, like lesion of the toes associated with SARS-CoV-2 infection, and not associated with merely temporal, or 17 healthy adolescents who presented with chilblain-like lesion from April 1st to June 30th, 2020 at a tertiary referral academic hospital. And they had all the workup and follow up 4 weeks and serological test, blood test, and also seen a dermatologist. And data do not support an association of chilblains with infection of COVID. So they said there was other causes, like children were walking barefoot at home or adults were walking barefoot and they have some other illnesses, they had diabetes. And so there's coincidence of other factors which caused this. So there is no association. There's no COVID toes. And the heart, yes, that is a complication of the vaccine. It causes pain and shortness of breath, pain in the chest and shortness of breath. And it has been reported after Pfizer or Moderna, and the numbers are there after 1 dose and then after 2nd dose. And you can see it almost doubled after the 2nd dose. So 573 cases after the 2nd dose and 216 after the 1st dose. And the who got it, mainly the median age was 30. I think 12 to 94, 94 is pretty stretched out. And they were younger people. And median time of symptoms development was 3 days to 0 to 33 days or 0 to 80 days. But 2nd dose, most common was 2nd day after 2nd dose. And gender distribution, they had twice as much males than the females. And after 2nd dose, there were 3-4 times males affected than the females. Younger group, males. And this is, as it been reported to the reporting center, worse. And you can see on the left side, 8.8% of dose administration were under 24, 12 to 15, 16, 17, 18, 24. So most of the cases were right here, 196. So younger people, little older as you get older, and over 65, only 26 people. So nursing home death after Pfizer vaccine, this was reported. And the cause was first reported in nursing home residents in Norway who received Pfizer vaccine. But they, you know, they did this study and they thought the causal link between Pfizer and death was likely in 10 out of 100. Possible 26 out of 100, unlikely 59 out of 100. So it was uncertain. There was no definite conclusion that nursing home deaths were related to the vaccine. But they were likely, they suggested 10% could be. Novavax announcement, press release June 14th. Is a recombinant nanoparticle, is a protein-based COVID-19 vaccine in phase 3, 29 or 30,000 participants, and there are 119 sites in US and Mexico. And they are a little late in coming out with their vaccine, 91% efficient in high-risk population and 100% efficient against variants, and 93% efficiency against predominantly circulating variants of concern and variants of interest, as we mentioned. So in the all COVID-19 hospitalization and deaths occurred in the placebo group, no important safety signal. And 12 to 18 is ongoing testing. And so it will be soon coming in next month or so. And here is this vaccine works. Here is a DNA which is injected into the cell. The cell responds by DNA converting into mRNA, which is then producing these proteins. These are called spike proteins. They go outside the cell, they form like this, and so they are providing or attacking the virus with this spike protein. So this is, diagram display of the virus. Moderna applies for, the approval, early decision, expansion to age 12 and 15. Last month, Pfizer applied it. Now they have applied. And they say there's 100% efficacy from symptomatic infection, and single dose provides 93% efficiency. And these people are followed for 12 months after second dose. World of Cement trade show in Las Vegas, June 8 to 12, 60,000 masonry professionals from around the world. They came in, no mask, no distance, social distancing. They checked their temperature and they enhanced the cleaning and air filtration. So far, no adverse effects from there. And this is CBS News poll. Are you feeling comfortable going to a restaurant or bar? And the results, to me, didn't really show much difference. All adults and fully vaccinated, they're comfortable going out. 75% they should be. And people who didn't get vaccine, 79% going out. They said, oh, what the heck, we're going out anyway. So here's your risk is 79% of them coming to one-on-one, they outnumbered you. So you're better off where the air circulation isn't good to wear a mask or sit outside. And this is, are you feeling comfortable going to a large event? And same numbers, all adults 45, fully vaccinated 42%, and won't get vaccinated 59%. They will go out anyway. So here's your reverse order, about 17% people chance of infection, maybe more, depends on the circumstances. And here is a couple of slides on cruising. Anybody goes to Mediterranean cruising, it's open, and passenger required to have 2 negative tests before boarding, and vaccination was not required. If they touch Florida, they can't ask this question. But some cruise line avoided going to Florida ports. Passengers and their parties in isolation before disembarking in Sicily if they were positive. So cruise ship infections, Royal Caribbean Celebrity Cruise out of St. Martin, first fully vaccinated cruise in North America. 2 with symptoms, passenger sharing stateroom tested positive, and positive during required testing before leaving the ship. They were put in isolation, and the contact tracing is underway. COVID antigen test recall, I don't think it will affect us. I'll just put it in there in case somebody tells you there's an antigen test available. But Innova Medical Group in Pasadena, California, went a little overboard and went to say that they have been approved, but they applied for EUA August 2020, never cleared for use. So it has been recalled, and they falsified their data. CDC requirement for face masks on public transportation and conveyances and at transportation centers, there's not much change. Fully vaccinated people no longer required to wear a mask in outdoor areas of conveyance and while outdoors at transportation hubs. And conveyances, airplanes, trains, subways, buses, taxis, ride shares, maritime transportation, trolleys, and cable cars. So fully vaccinated are okay. So this is a promoting vaccination and healthcare venue by CDC. And the takeout is that emergency room department or emergency services and urgent care facilities promoting vaccination. So because urgent care clinics handle 89 million patient visits, or 29% of all primary care visits and 15% of all outpatient physician visits. So they should allocate vaccines to EDs and UCs, urgent cares and emergency room, and prioritize facilities located in countries with high social vulnerability indices. So this is a CDC recommendation that these places should have priority. OSHA, COVID rules for healthcare employees. They just had these rules for healthcare employees, not for anybody else. Meatpacking, corrections, retail stores, there is no rules. But for healthcare, screen and triage patient for risk of COVID, ensure adequate ventilation and space for distancing, and provide paid time off for workers to receive vaccination. And fully vaccinated workers will not be required to wear masks or practice social distancing when in well-defined area where people are unlikely to have COVID-19. Pretty simple. And this is the last slide. Sotrovimab is an injectable and you can give it intravenously. For emergency use, authorization will be approved in the next few weeks for treatment of COVID-19. So this is just the information, and I think the treatment is available and is effective. Good. How about that? Kara? Oh, yes. And let's see, anyone has question? Okay. Did I answer one of your concerns?
Yeah, you did. You did. Thank you.
Yeah, being isolated at home. I think if you want to, if your parents are vaccinated, you can see them without mask. But if there's other people who are, you're not sure, or they're not vaccinated, if you're not sure, you take them as unvaccinated. So you wear a mask, and if you're indoor, stay 6 feet or 3 feet apart. And if you're outdoor, you can be 3 feet away from them. And if you can cut down the time with the unvaccinated people to 15 minutes, that's fine. So, and you have a protection. Your chances of getting it like 2 in 10.
So it's possible that if fully vaccinated people, Lee and I are both fully vaccinated, we can go over and visit with Bonnie and Wade in their house as we did 2 years ago with no problem.
Yes, you are all vaccinated. You are protected. She's protected. You will not have infection. You are not a carrier and asymptomatic carrier. You have antibodies, so you can mingle and you can go on picnic or go for dinner or be in the house.
Well, I think I'm a lot more comfortable right now at this point, just visiting in homes with fully vaccinated people, because even going in bars or restaurants, I still feel like I'm not comfortable doing that, not knowing who's where, even though you're not probably going to be 15 minutes in contact with them, but you just never know.
Yes. And
so it's just, we do a lot of carryouts. That's what we do here.
Yeah, that's.
So Penny, you can come back out into the world.
Yeah.
Well, I will tell you that yesterday I had a dental appointment, and they were very cautious there, whatever, but I did go to visit and they were outside and I still wore a mask, and there was someone that had to make a snarky comment, about why, like, why do you have a mask on? You've been fully vaccinated. And it was like, gosh, I'm trying to protect myself. I'm not hurting anybody. Why do people have to comment? You know what I'm saying?
Yeah, you put a deaf ear to that.
Yeah, you don't listen to them. It's your freedom to do that. We went to Menards tonight, and Lee and I both put a mask on when we went into Menards, because we did not know, even though we probably wouldn't have been in contact with somebody for 15 minutes, but we didn't take the chance. We both wore a mask, and when we came out of the Menards, then we took the mask off.
Yeah, that's the right thing to do.
Yeah.
And that's your freedom, Penny. People can talk. Let them talk. Who cares?
I know, but then you know what I mean? It bothered me because I was like, even though it was just, they were joking, it still hurt my face. You know what I mean? I'm just like, I have major anxiety over all of this. You know what I mean? And I'm like, I had to explain that. I'm like, I have really bad anxiety. I'm wearing a mask. I'm not hurting any. I feel like I had to explain it. And I'm like, honest to gosh, I hardly get out. And I do once. And then somebody says a comment to me.
Yeah.
Consider the source.
I will. What you're having is quite common, and you're handling it well.
Oh, I hope so.
Okay, so
thank you for doing that.
Yeah, appreciate all your work on this, Doc.
Okay, I'm very thankful that you come every week and listen to this, and at least if I can help
I have 2 or 3 people that tell me that they go in and view the slides, you know, because they can't attend tonight, but they do go in and view your slides and listen to the recording. So that's good.